Emergency departments are potentially harmful for people who have just attempted suicide because they're very highly procedural and quite intense environments. And so when somebody presents to ED following a suicide attempt, they're typically distressed, they might be embarrassed, they are likely to be withdrawn. And so if they then receive a response from ED staff that's in any way dismissive or makes them feel less valued as part of that interaction, it can really impact on what the whole engagement process that needs to follow that to commence the recovery journey. And so once a person has had their physical injuries tended to, the timeliness of the mental health assessment that needs to follow and particularly creates the conduit to referring on can often be delayed for long periods of time, leaving people sitting in that very intense environment, feeling very, very uncomfortable for long periods of time. The transition of care from hospital to community-based care is absolutely critical, and it's something that we know makes a really big difference if people who have made an attempt to take their own lives do actually engage well with those community and other services.
Transition is very, very important for the patient. There's no doubt about it. I think this is where you hear that people slip through the cracks or fall through the cracks. I think this is a real risk point for that to happen for a patient. For me personally, I was very lucky with my transitions. I think from the psych ward or the PEC unit at the hospital after being taken to emergency, that was all handled by the hospital, so that was quite seamless. I don't even really remember it, to be honest. I just got wheeled from one spot into another. But then the exit from the hospital and the discharge into the rehabilitation program, again, I know that the psychiatrist from the hospital spoke to the psychiatrist at the rehabilitation centre. I don't know whether that was by phone or just by medical notes, but it certainly occurred. So once I got there, I didn't have to explain myself to them. They knew everything, which is really important. I didn't have to go through the whole thing again.
The research tells us that around about 50% of people don't take up the clinical care that's available to them following that presentation, and of those that do, many drop out early. We also know it's a very heightened period of risk for people of reattempt in those initial days and weeks, particularly after leaving hospital. And further to that, we've now got some initial evidence that indicates that after hospital care programs that provide that assertive outreach, non-clinical care, and in particularly with a focus on ensuring people do access the supports and the clinical programs available to them, have shown up to a 20% decrease in suicide attempts.
I think probably the most important transition in my experience was the one from the private rehabilitation that I was in for 4 weeks, back out into the world, as I call it. And that was the one that was a little loose, I feel. I just don't feel that there was enough structure around my exit plan. As I mentioned, I don't think my family and my carers had enough buy-in and understanding, and it definitely shouldn't be up to the patient to educate their family when they've just gone through a crisis only a few weeks before. It's just an impossible thing to do well, if at all. Beyond Blue have developed the Way Back support service. It is an assertive aftercare program. It's a non-clinical program which focuses on providing a rapid response to people after a suicide attempt. The service is provided for up to 3 months. The service is very much established as a local partnership between a non-clinical service provider, utilising a psychosocial outreach approach, but very much in partnership with the hospital-based mental health services. The hospital-based mental health services are very much the key referrer to the service, and there's also an important escalation relationship with that service. And so we're finding the more we're rolling this service out, the more we're seeing how important that relationship between hospital mental health teams and the Way Back non-clinical teams really is, because that's
where the referrals are going to come from. With some of the earlier pilots, there are attempts to engage the ED triage team, and it's almost impossible to embed a protocol with that team because they get pulled in so many different directions. Establishing that relationship with the hospital mental health team has made a huge difference to the way that referrals have flowed through to us, and made a huge difference to the responsiveness once we need to go back the other way. I think there's a number of key things that can make a difference in terms of the experience people have in the emergency department. One area that we've focused on, and I think it's been pretty well documented in other areas, is the importance of a non-judgemental and compassionate response from emergency department staff, and also taking that back to promoting that with paramedics as well in terms of the transport to hospital and the role that they have. Again, we know if that experience is one where there is a care felt and experienced by the person, we know that has some bearing on the likelihood of them engaging beyond that. And so, to ensure that we can really promote that well, there's a real need for training and awareness building amongst those key staff. The other thing that we've found makes a big difference in the emergency department is having really strong protocols for around how hospital mental health teams respond in the emergency department. The way that assessment's conducted, the timeliness of that assessment, the care and compassion shown by the mental health clinician, and indeed the referral process that comes out of that are all really important sort of steps, and they're all issues that, if done well, can make a real difference in the emergency department.
I was obviously struggling, and the empathy and care that he showed me with no judgment at all was so powerful that it was able to change my mind from thinking that I wanted to die to thinking that I wanted to live. And that is incredibly powerful, and that's empathy. There's no question about it.